81. What is the primary purpose of using post-treatment imaging in brachytherapy? A. To assess the tumor response to radiation. B. To identify the number of radiation seeds remaining in the body. C. To determine the need for additional radiation therapy. D. To monitor for potential long-term complications. Answer. A. To assess the tumor response to radiation. Rationale. Post-treatment imaging, A, is primarily used to evaluate how well the tumor responds to the radiation dose. While tracking radiation seeds, B, may be done in some cases, the main goal is to assess tumor response, A, and not necessarily determine the need for additional therapy, C, or monitor for long-term complications, D. 82. Which of the following factors should be considered when determining the appropriate radiation dose in brachytherapy? A. Patient age. B. Tumor location and size. C. Tumor grade and histology. D. All of the above. Answer. D. All of the above. Rationale. The appropriate radiation dose in brachytherapy, D, is influenced by factors such as patient age, A, tumor location and size, B, and tumor grade and histology, C, which help determine the most effective treatment plan. 83. What is the recommended procedure if a patient experiences a radiation burn after brachytherapy? A. Immediate surgery to remove damaged tissue. B. Apply ice packs to the area. C. Topical creams and follow-up care. D. Discontinue the radiation treatment immediately. Answer. C. Topical creams and follow-up care. Rationale. Radiation burns, C, are managed with topical creams and follow-up care, including monitoring for healing. Surgery, A, is not necessary unless there is significant tissue damage. Ice packs, B, and discontinuation of treatment, D, are not typically recommended for radiation burns. 84. Which imaging technique is commonly used to confirm the correct placement of the radioactive source during brachytherapy? A. X-ray. B. MRI. C. CT scan. D. Ultrasound. Answer. C. CT scan. Rationale. CT scans, C, are commonly used to verify the correct placement of the radioactive source during brachytherapy, providing accurate, real-time images. While X-ray, A, MRI, B, and ultrasound, D, can be useful in some cases, CT is the preferred method for precise guidance. 85. What is the purpose of the catheter used in intraluminal brachytherapy for treating esophageal cancer? A. To deliver high doses of radiation directly to the tumor. B. To monitor the tumor's growth. C. To prevent bleeding in the treatment area. D. To provide a pathway for chemotherapy delivery. Answer. A. To deliver high doses of radiation directly to the tumor. Rationale. The catheter, A, in intraluminal brachytherapy is used to deliver radiation directly to the tumor, providing a high dose with minimal exposure to surrounding healthy tissue. It does not monitor tumor growth, B, prevent bleeding, C, or deliver chemotherapy, D. 86. What is one of the primary challenges of brachytherapy in the treatment of breast cancer? A. Difficulty in accessing tumors in the breast tissue. B. The need for daily treatments. C. The risk of damage to the heart and lungs. D. The inability to treat tumors near the skin surface. Answer. C. The risk of damage to the heart and lungs. Rationale. The main challenge, C, in breast cancer brachytherapy is the potential risk to the heart and lungs due to their proximity to the breast tissue. Tumor access, A, is generally not a challenge and brachytherapy does not require daily treatments, B. It can be used for tumors near the skin, D. 87. In the treatment of prostate cancer, what is the purpose of the post-implant dosimetry process? A. To determine the correct amount of radiation delivered during the implant. B. To identify the exact position of the prostate. C. To monitor side effects during treatment. D. To calculate the patient's future treatment schedule. Answer. A. To determine the correct amount of radiation delivered during the implant. Rationale. Post-implant dosimetry, A, is performed to assess the exact radiation dose delivered to the prostate, ensuring that the tumor receives the planned dose. It does not determine the prostate's position, B, monitor side effects, C, or calculate future treatments, D. 88. How long does the radioactive seed remain active in the body during permanent seed brachytherapy for prostate cancer? A. A few hours. B. A few days. C. A few months. D. A few years. Answer: seed, a few months. Rationale: the radioactive seeds used in prostate brachytherapy remain active for several months. C. Delivering continuous radiation to the prostate. They do not remain active for just hours. A. Days. B. Or years. D. 89. Which of the following is a contraindication for brachytherapy? A. Tumors located in close proximity to vital organs. B. Patients with a history of radiation therapy. C. Patients who are pregnant. D. All of the above. Answer: D. All of the above. Rationale: all of these conditions, D, may contraindicate brachytherapy as tumors near vital organs. A. A history of prior radiation. B. And pregnancy. C. Pose significant risks to the patient. 90. What is one major advantage of brachytherapy over external beam radiation for certain cancers? A. It requires fewer follow-up appointments. B. It delivers radiation to a larger area. C. It allows higher doses of radiation directly to the tumor with less damage to surrounding tissues. D. It can be used for tumors located anywhere in the body. Answer: C. It allows higher doses of radiation directly to the tumor with less damage to surrounding tissues. Rationale: brachytherapy, C, allows a higher, more focused dose of radiation directly to the tumor while minimizing damage to surrounding tissues. It does not require fewer follow-ups. A. Deliver radiation to a larger area. B. Or treat tumors everywhere. D. 91. How does the radiation dose differ in high-dose rate, HDR, brachytherapy compared to low-dose rate, LDR, brachytherapy? A. HDR delivers radiation over a longer period. B. HDR delivers a higher dose of radiation in a shorter period. C. HDR involves permanent implants. D. HDR requires multiple treatments over several weeks. Answer: B. HDR delivers a higher dose of radiation in a shorter period. Rationale: HDR brachytherapy, B, delivers a higher dose of radiation in a shorter period compared to LDR. HDR does not involve permanent implants, C, and it typically requires fewer treatments, D. 92. What is the purpose of using an applicator in intracavitary brachytherapy for cervical cancer? A. To hold the radioactive source in place. B. To monitor for complications during treatment. C. To provide external radiation to the tumor. D. To allow easy removal of radioactive materials. Answer: A. To hold the radioactive source in place. Rationale: the applicator, A, in intracavitary brachytherapy is used to position the radioactive source inside the body, ensuring it remains in the correct location for optimal radiation delivery. It does not provide external radiation, C, or assist in material removal, D. 93. What is the typical duration of a single brachytherapy treatment session for prostate cancer using permanent seed implantation? A. A few minutes. B. 30 minutes to 1 hour. C. 2 to 3 hours. D. Several hours over multiple sessions. Answer: B. 30 minutes to 1 hour. Rationale: a typical permanent seed implantation session for prostate cancer, B, usually lasts 30 minutes to 1 hour. It does not take only a few minutes, A, nor does it extend over several hours, D. 94. Which of the following is a potential side effect of brachytherapy for prostate cancer? A. Hair loss. B. Diarrhea. C. Erectile dysfunction. D. Nausea and vomiting. Answer: C. Erectile dysfunction. Rationale: erectile dysfunction, C, is a common side effect of brachytherapy for prostate cancer due to the radiation's effect on the nerves and blood vessels in the pelvic region. Hair loss, A, diarrhea, B, and nausea, D, are less common for this type of therapy. 95. What is the goal of the radiation safety precautions in brachytherapy? A, to protect the patient from harm. B, to prevent radiation exposure to non-targeted areas. C, to minimize radiation exposure to healthcare workers. D, all of the above. Answer: D, all of the above. Rationale: radiation safety precautions, D, aim to protect both the patient, A, minimize exposure to non-targeted areas, B, and ensure the safety of healthcare workers, C. 96. What is the primary difference between high-dose rate, HDR, and low-dose rate, LDR, brachytherapy? A. HDR uses smaller radioactive sources. B. HDR delivers radiation in a shorter period, while LDR delivers over a longer period. C. LDR uses external radiation. D. HDR requires fewer treatment sessions. Answer. B. HDR delivers radiation in a shorter period, while LDR delivers over a longer period. Rationale. HDR, B, delivers radiation in a higher dose over a short time, while LDR provides continuous, lower doses over a longer period. Both use radioactive sources, but HDR does not necessarily require fewer sessions, D, and does not involve external radiation, C. 97. What is a major advantage of brachytherapy over external beam radiation for some cancers? A. It requires fewer hospital visits. B. It can target tumors with a higher dose of radiation while sparing surrounding tissue. C. It is less expensive than external beam radiation. D. It has fewer side effects. Answer. B. It can target tumors with a higher dose of radiation while sparing surrounding tissue. Rationale. Brachytherapy, B, allows a higher, more focused dose of radiation directly to the tumor, which minimizes the radiation dose to healthy, surrounding tissue. It may require fewer visits, A, but it is not necessarily less expensive, C, and may have similar side effects. 98. Which imaging modality is often used to confirm the placement of radioactive seeds during prostate brachytherapy? A. MRI. B. X-ray. C. CT scan. D. Ultrasound. Answer. C. CT scan. Rationale. CT scans, C, are commonly used to confirm the accurate placement of radioactive seeds in prostate brachytherapy due to their precision in imaging. MRI, A, X-ray, B, and ultrasound, D, may be used in some cases, but are not as precise for seed placement. 99. How are the radioactive seeds used in permanent seed brachytherapy for prostate cancer typically eliminated from the body? A. Through the digestive system. B. Through urine. C. Through the lymphatic system. D. They remain in the body permanently. Answer. B. Through urine. Rationale. The radioactive seeds used in prostate brachytherapy are typically eliminated through urine, B, after their radiation activity has decayed. They do not remain in the body permanently, D. 100. What is the most common complication of brachytherapy for gynecological cancers, such as cervical cancer? A. Vaginal stenosis. B. Hair loss. C. Gastrointestinal bleeding. D. Brain swelling. Answer. A. Vaginal stenosis. Rationale. Vaginal stenosis, A, or narrowing of the vaginal canal, is a common complication of brachytherapy for cervical cancer due to radiation-induced tissue damage. Hair loss, B, gastrointestinal bleeding, C, and brain swelling, D, are not typical for gynecological brachytherapy. 101. What is the purpose of the use of a bladder catheter during prostate brachytherapy? A, to help locate the tumor. B, to protect the bladder from radiation exposure. C, to prevent the prostate from moving during treatment. D, to administer anesthesia. Answer. C, to prevent the prostate from moving during treatment. Rationale. A bladder catheter, C, is used in prostate brachytherapy to ensure that the prostate stays in a fixed position during the procedure. It does not locate the tumor, A, protect the bladder, B, or administer anesthesia, D. 102. How is the radiation dose typically delivered in high-dose rate, HDR, brachytherapy? A, in a single high dose over a short time. B, in multiple smaller doses over several days. C, continuously over several weeks. D, through external beam radiation. Answer. A, in a single high dose over a short time. Rationale. HDR brachytherapy, A, delivers a high dose of radiation in a short period. It does not involve multiple smaller doses, B, continuous delivery, C, or external beam radiation, D. 103. What is the main goal of brachytherapy in the treatment of prostate cancer? A, to cure metastatic prostate cancer. B, to shrink the prostate gland. C, to deliver a high dose of radiation to the prostate with minimal impact on surrounding tissues. D, to relieve pain associated with prostate cancer. Answer: C. To deliver a high dose of radiation to the prostate with minimal impact on surrounding tissues. Rationale: the main goal of prostate brachytherapy, C, is to deliver high doses of radiation directly to the tumor while minimizing exposure to surrounding healthy tissue. It is not primarily for metastatic cancer, A, shrinking the prostate, B, or pain relief, D. 104. How is brachytherapy administered in the treatment of breast cancer? A. By placing radioactive seeds directly into the tumor. B. By using external beam radiation. C. Through an intravenous injection. D. By inserting a catheter into the breast tissue. Answer: A. By placing radioactive seeds directly into the tumor. Rationale: in breast cancer brachytherapy, A, radioactive seeds are placed directly into or near the tumor to deliver localized radiation. External beam radiation, B, is a different form of treatment, and brachytherapy does not involve intravenous injections, C, or catheters, D, in this case. 105. What is the primary use of interstitial brachytherapy? A. To treat tumors located deep within the body. B. To treat cancers that have spread to lymph nodes. C. To treat tumors on the skin surface. D. To provide a non-radiation treatment for cancer. Answer: A. To treat tumors located deep within the body. Rationale: interstitial brachytherapy, A, is used for tumors that are located deep within the body, such as in the prostate or breast. It is not used to treat lymph node metastases, B, skin cancers, C, or as a non-radiation treatment, D. 106. In what way does brachytherapy differ from external beam radiation therapy? A. Brachytherapy uses a more concentrated dose of radiation directly at the tumor. B. External beam radiation delivers a higher dose of radiation. C. Brachytherapy is more effective for skin cancers. D. External beam radiation requires no planning. Answer: A. Brachytherapy uses a more concentrated dose of radiation directly at the tumor. Rationale: brachytherapy, A, delivers a concentrated dose of radiation directly to the tumor, while external beam radiation spreads the dose over a larger area. It is not necessarily more effective for skin cancers, C, and external beam radiation requires detailed planning, D. 107. Which of the following is a benefit of using brachytherapy in treating early-stage prostate cancer? A. It involves a shorter treatment time compared to surgery. B. It can be done without anesthesia. C. It does not require any follow-up care. D. It does not cause any long-term side effects. Answer: A. It involves a shorter treatment time compared to surgery. Rationale: brachytherapy, A, typically involves a shorter treatment time compared to surgery, offering a less invasive option for early-stage prostate cancer. It does require follow-up care, C, can cause some side effects, D, and usually involves anesthesia, B. 108. What is the recommended management for a patient who experiences urinary retention after prostate brachytherapy? A. Immediate catheter removal. B. Medication to relax the bladder muscles. C. Immediate prostatectomy. D. Radiation to the bladder area. Answer: B. Medication to relax the bladder muscles. Rationale: urinary retention, B, can be managed with medications that relax the bladder muscles. Immediate catheter removal, A, and prostatectomy, C, are not recommended unless there are complications, and radiation to the bladder, D, is not used for this purpose. 109. What is one potential side effect of brachytherapy for breast cancer? A. Skin irritation and fibrosis. B. Severe pain and inflammation. C. Permanent nerve damage. D. Loss of appetite and nausea. Answer: A. Skin irritation and fibrosis. Rationale: skin irritation and fibrosis, A, are common side effects of brachytherapy for breast cancer due to the radiation. Severe pain and inflammation, B, permanent nerve damage, C, and loss of appetite, D, are not typical side effects of this therapy. 110. How does the radiation from brachytherapy affect the tumor? A. It destroys tumor cells by damaging their DNA. B. It shrinks the tumor by blocking blood flow. C. It stimulates the tumor cells to grow faster. D. It makes the tumor more sensitive to chemotherapy. Answer: A. It destroys tumor cells by damaging their DNA. Rationale: brachytherapy works, A, by delivering radiation directly to the tumor, which damages the DNA of the cancer cells and prevents them from reproducing. It does not shrink the tumor by blocking blood flow, B, stimulate growth, C, or make it more sensitive to chemotherapy, D. 111. In which of the following cancers is brachytherapy most commonly used? A. Brain cancer. B. Prostate cancer. C. Lung cancer. D. Colon cancer. Answer: B. Prostate cancer. Rationale: brachytherapy is most commonly used, B, for prostate cancer, both in low-risk and high-risk cases. It is not typically used for brain, A, lung, C, or colon, D, cancers. 112. What is the typical procedure for placing radioactive seeds in prostate cancer brachytherapy? A. A minimally invasive surgery using a robot. B. A surgical procedure requiring general anesthesia. C. A needle insertion through the perineum guided by ultrasound. D. A large incision to insert the radioactive seeds. Answer: C. A needle insertion through the perineum guided by ultrasound. Rationale: the typical procedure, C, for prostate brachytherapy involves inserting needles through the perineum to place radioactive seeds, with ultrasound guidance to ensure accuracy. It is minimally invasive and does not require a large incision, D, or general anesthesia, B. 113. What is a typical use of temporary brachytherapy in cancer treatment? A. To treat early-stage prostate cancer. B. To treat certain gynecological cancers like cervical cancer. C. To deliver radiation to distant metastases. D. To shrink tumors for surgery. Answer: B. To treat certain gynecological cancers like cervical cancer. Rationale: temporary brachytherapy, B, is often used in the treatment of gynecological cancers like cervical cancer, where radiation is placed temporarily inside the body. It is not used for distant metastases, C, or solely for shrinking tumors for surgery, D. 114. How does brachytherapy compare to external beam radiation in terms of treatment duration? A. Brachytherapy requires longer treatment durations. B. Brachytherapy typically involves a longer number of sessions. C. Brachytherapy can be completed in a shorter amount of time. D. There is no difference in treatment duration. Answer: C. Brachytherapy can be completed in a shorter amount of time. Rationale: brachytherapy, C, typically involves fewer treatment sessions and a shorter overall treatment time compared to external beam radiation. Answer: C. Brachytherapy can be completed in a shorter amount of time. Rationale: brachytherapy, C, typically involves fewer treatment sessions and a shorter overall treatment time compared to external beam radiation. 115. What is a major concern during the planning phase of prostate brachytherapy? A. Ensuring the prostate is completely removed. B. Ensuring precise placement of radioactive seeds to avoid damage to surrounding tissues. C. Reducing the tumor size before treatment. D. Preventing the patient from moving during treatment. Answer: B. Ensuring precise placement of radioactive seeds to avoid damage to surrounding tissues. Rationale: the planning phase, B, focuses on ensuring that the radioactive seeds are accurately placed to deliver the correct dose to the tumor while minimizing exposure to surrounding tissues. Prostate removal, A, is not the goal of this procedure. 116. Which of the following is a key factor in determining the success of brachytherapy treatment? A. The size and location of the tumor. B. The patient's age. C. The type of radiation used. D. The patient's family history of cancer. Answer: A. The size and location of the tumor. Rationale: the success of brachytherapy, A, is primarily determined by the size and location of the tumor, which influences how effectively the radiation can be delivered. Age, radiation type, and family history are secondary factors. 117. What is the typical method of radiation source placement in temporary brachytherapy? A. Radioactive seeds are placed permanently. B. A catheter or applicator is inserted temporarily to deliver radiation. C. Radiation is applied externally to the tumor. D. Radioactive needles are placed directly into the tumor without guidance. Answer: B. A catheter or applicator is inserted temporarily to deliver radiation. Rationale: in temporary brachytherapy, B, A catheter or applicator is inserted temporarily to deliver radiation to the tumor. Permanent seed placement is not part of temporary brachytherapy. A. 118. What role does ultrasound play in prostate brachytherapy? A. To determine the patient's eligibility for treatment. B. To guide the placement of the radioactive seeds. C. To monitor tumor shrinkage after treatment. D. To detect the presence of distant metastases. Answer. B. To guide the placement of the radioactive seeds. Rationale. Ultrasound, B, is used in prostate brachytherapy to guide the precise placement of radioactive seeds into the prostate gland. It does not detect metastases, D, or monitor tumor shrinkage, C. 119. Which of the following cancers is not typically treated with brachytherapy? A. Prostate cancer. B. Cervical cancer. C. Lung cancer. D. Breast cancer. Answer. C. Lung cancer. Rationale. Brachytherapy, C, is not commonly used for lung cancer. It is more often used for prostate, A, cervical, B, and breast, D, cancers. 120. What is a key advantage of brachytherapy over traditional external beam radiation therapy? A. It requires no specialized equipment. B. It can deliver a higher dose of radiation directly to the tumor. C. It is less expensive. D. It does not require radiation planning. Answer. B. It can deliver a higher dose of radiation directly to the tumor. Rationale. Brachytherapy, B, delivers a concentrated dose of radiation directly to the tumor, minimizing exposure to surrounding healthy tissue. It still requires specialized equipment, A, planning, D, and may not be less expensive, C. 121. What is the most common radioactive isotope used in prostate brachytherapy? A. Cesium-137. B. Iodine-125. C. Cobalt-60. D. Iridium-192. Answer. B. Iodine-125. Rationale. Iodine-125B is the most commonly used isotope in prostate brachytherapy due to its favorable radiation characteristics for tumor treatment. Cesium-137A, Cobalt-60C, and Iridium-192D are used in other forms of radiation therapy. 122. What is the potential complication associated with brachytherapy for cervical cancer? A. Urinary retention. B. Vaginal bleeding and discomfort. C. Shortness of breath. D. Vision problems. Answer. B. Vaginal bleeding and discomfort. Rationale. Vaginal bleeding and discomfort, B, are common complications after brachytherapy for cervical cancer due to radiation effects on the vaginal tissues. Urinary retention, A, is more common in prostate brachytherapy, while shortness of breath, C, and vision problems, D, are not typical. 123. How does brachytherapy differ in its approach to delivering radiation compared to external beam radiation therapy? A. Brachytherapy delivers radiation from an external source. B. Brachytherapy involves placing radiation sources inside the body. C. Brachytherapy requires a larger treatment area. D. Brachytherapy is not effective for treating solid tumors. Answer. B. Brachytherapy involves placing radiation sources inside the body. Rationale. Brachytherapy, B, involves placing radioactive sources directly inside or near the tumor, while external beam radiation therapy delivers radiation from outside the body. 124. What is the most common radiation dose rate used in prostate brachytherapy? A. Low dose rate, LDR. B. High dose rate, HDR. C. Medium dose rate, MDR. D. Very low dose rate, VLDR. Answer. A. Low dose rate, LDR. Rationale. Low dose rate, LDR, is the most common radiation dose rate used in prostate brachytherapy, providing continuous radiation over a longer period. HDR-B is also used but in different treatment settings. 125. What type of tumor is usually targeted in breast cancer brachytherapy? A. Tumors near the skin surface. B. Deep tumors located within the breast tissue. C. Tumors located in the chest cavity. D. Tumors in lymph nodes. Answer. A. Tumors near the skin surface. Rationale. Brachytherapy, A, is most commonly used for treating tumors near the surface of the breast tissue. Tumors deeper within the breast tissue, B, are typically treated with external beam radiation. 126. What type of imaging is typically used to monitor the radiation therapy dose during treatment? A, MRI, B, X-ray, C, ultrasound, D, PET scan. Answer, C, ultrasound. Rationale: ultrasound, C, is commonly used to monitor radiation placement during brachytherapy, particularly in prostate cancer treatment. MRI, A, X-ray, B, and PET scan, D, are not typically used for real-time radiation monitoring. 127. What is the purpose of the planning CT scanned in brachytherapy? A, to measure tumor shrinkage. B, to visualize the tumor and surrounding tissues for accurate placement of radioactive sources. C, to determine the patient's eligibility for brachytherapy. D, to detect metastases in nearby lymph nodes. Answer: B, to visualize the tumor and surrounding tissues for accurate placement of radioactive sources. Rationale: a planning CT scan, B, is crucial for visualizing the tumor and surrounding tissue to ensure accurate placement of the radioactive seeds or sources in brachytherapy. 128. Which of the following is a major limitation of brachytherapy? A, it is only effective for small tumors. B, it can only treat tumors in the gastrointestinal tract. C, it may not be suitable for tumors that are too close to critical structures. D, it requires a long recovery time. Answer: C, it may not be suitable for tumors that are too close to critical structures. Rationale: one limitation of brachytherapy, C, is that it may not be effective for tumors located too close to critical structures, as the radiation could damage healthy tissues. 129. How does brachytherapy for prostate cancer reduce the risk of damaging healthy tissue? A, by delivering radiation from a distance. B, by focusing radiation directly on the tumor. C, by using a higher total dose of radiation. D, by using multiple radiation beams from different angles. Answer: B, by focusing radiation directly on the tumor. Rationale: brachytherapy, B, delivers radiation directly to the tumor with a higher concentration, reducing the risk of damaging surrounding healthy tissues. 130. What is the role of a radiation oncologist in the treatment process of brachytherapy? A, to administer anesthesia. B, to guide the placement of the radioactive seeds. C, to develop the treatment plan and oversee the delivery of radiation. D, to monitor for tumor shrinkage. Answer: C, to develop the treatment plan and oversee the delivery of radiation. Rationale: a radiation oncologist, C, is responsible for creating the treatment plan and overseeing the radiation delivery process to ensure the correct dosage and placement. They do not administer anesthesia, A, or guide seed placement, B. 131. What is the significance of the radioactive decay of the sources used in brachytherapy? A, it helps to minimize the radiation dose over time. B, it prevents the sources from becoming too active. C, it allows the radiation to continue long after treatment. D, it ensures that the radiation will not affect the tumor. Answer: A, it helps to minimize the radiation dose over time. Rationale: the radioactive decay, A, of the sources reduces the radiation dose over time, limiting the amount of radiation exposure to the tumor and surrounding tissues after the therapy. 132. What is one common post-treatment side effect of prostate brachytherapy? A, hair loss. B, fatigue. C, nausea and vomiting. D, vision changes. Answer: B, fatigue. Rationale: fatigue, B, is a common post-treatment side effect of prostate brachytherapy. Hair loss, A, nausea, C, and vision changes, D, are not typical side effects. 133. What type of cancer is typically treated using high-dose rate, HDR, brachytherapy? A, prostate cancer. B, head and neck cancer. C, skin cancer. D, breast cancer. Answer: B, head and neck cancer. Rationale: high-dose rate, HDR, brachytherapy, B, is commonly used for treating head and neck cancers. Other types of cancer, such as prostate, A, and breast, D, cancers, typically use low-dose rate, LDR, brachytherapy. 134. How is the radiation dose for brachytherapy determined? A. It's based on the tumor size, location, and type. B. It's based on the patient's age and medical history. C. Based on the total time of treatment. D. It's based on the patient's pain level. Answer: A. Based on the tumor size, location, and type. Rationale: the radiation dose, A, is determined by factors such as the tumor size, location, and type to ensure effective treatment while minimizing damage to surrounding tissues. 135. What is the purpose of post-treatment imaging in brachytherapy? A. To verify the placement of radiation sources. B. To monitor the patient's response to the treatment. C. To determine the optimal radiation dose. D. To predict tumor recurrence. Answer: B. To monitor the patient's response to the treatment. Rationale: post-treatment imaging, B, helps to monitor the patient's response to brachytherapy and assess how the tumor is responding to radiation. It is not primarily used for source placement, A, or predicting recurrence, D. 136. In which situation is temporary brachytherapy most commonly used? A. For tumors in deep tissues that require precise, localized treatment. B. For small superficial tumors. C. For metastatic tumors that have spread throughout the body. D. For benign growths or cysts. Answer: A. For tumors in deep tissues that require precise, localized treatment. Rationale: temporary brachytherapy, A, is often used for tumors in deep tissues, such as prostate or cervical cancers, where precise radiation delivery is needed. 137. Which radiation source is used in high-dose rate, HDR, brachytherapy? A. Iridium-192. B. Iodine-125. C. Cesium-137. D. Cobalt-60. Answer: A. Iridium-192. Rationale: Iridium-192, A, is commonly used in HDR brachytherapy due to its ability to deliver high doses of radiation over a short time. Iodine-125, is typically used for low-dose rate brachytherapy. 138. What is the most common type of brachytherapy used to treat breast cancer? A. Intraoperative brachytherapy. B. Interstitial brachytherapy. C. Intracavitary brachytherapy. D. Superficial brachytherapy. Answer: A. Intraoperative brachytherapy. Rationale: intraoperative brachytherapy, A, is often used to treat breast cancer, delivering radiation directly to the tumor bed during surgery. 139. How is the radioactive source removed in temporary brachytherapy after the treatment? A. It is removed by a surgeon in a separate procedure. B. It is naturally absorbed by the body. C. It is retrieved using a catheter or applicator. D. It is left in place permanently. Answer: C. It is retrieved using a catheter or applicator. Rationale: in temporary brachytherapy, C, the radioactive source is removed through a catheter or applicator after the required dose has been delivered. 140. What is a key disadvantage of permanent seed brachytherapy? A. It delivers radiation continuously for months, affecting surrounding healthy tissue. B. It requires repeated hospital visits for radiation delivery. C. It is more costly than external beam radiation therapy. D. It does not require radiation planning. Answer: A. It delivers radiation continuously for months, affecting surrounding healthy tissue. Rationale: one disadvantage of permanent seed brachytherapy, A, is that the radiation is continuously delivered over time, potentially affecting surrounding healthy tissue. 141. Which of the following is an example of intracavitary brachytherapy? A. Prostate brachytherapy. B. Cervical brachytherapy. C. Lung brachytherapy. D. Brain tumor brachytherapy. Answer: B. Cervical brachytherapy. Rationale: intracavitary brachytherapy, B, is commonly used in cervical cancer, where the radiation sources are placed inside body cavities, such as the cervix. 142. What is the role of a physicist in brachytherapy? A. To provide counseling to the patient. B. To develop the treatment plan and ensure proper radiation delivery. C. To administer radiation therapy. D. To perform surgery during the treatment. Answer: B. To develop the treatment plan and ensure proper radiation delivery. Rationale: a physicist, B, Works closely with the medical team to develop the treatment plan, calculate radiation doses, and ensure the proper delivery of radiation. 143. What factor most influences the effectiveness of brachytherapy? A. The radiation dose rate. B. The radiation energy. C. The duration of the treatment. D. The type of cancer being treated. Answer. A. The radiation dose rate. Rationale. The radiation dose rate, A, is crucial to the effectiveness of brachytherapy. The energy, duration, and cancer type are secondary considerations. 144. What is the key difference between low-dose rate, LDR, and high-dose rate, HDR, brachytherapy? A. LDR brachytherapy uses permanent radioactive seeds, while HDR uses temporary sources. B. LDR brachytherapy is more effective than HDR. C. LDR brachytherapy requires larger radiation doses. D. HDR brachytherapy has a longer treatment duration than LDR. Answer. A. LDR brachytherapy uses permanent radioactive seeds, while HDR uses temporary sources. Rationale. The main difference, A, is that LDR uses permanent radioactive seeds, while HDR uses temporary sources. HDR has shorter treatment durations, but both have similar efficacy. 145. What is one reason for using high-dose rate, HDR, brachytherapy over low-dose rate, LDR, brachytherapy? A. HDR brachytherapy delivers radiation over a longer period. B. HDR brachytherapy allows for more precision and shorter treatment duration. C. HDR brachytherapy is less costly. D. HDR brachytherapy is only used for prostate cancer. Answer. B. HDR brachytherapy allows for more precision and shorter treatment duration. Rationale. HDR brachytherapy, B, delivers radiation more precisely and over a shorter time compared to LDR, making it a preferred option for certain cancers. 146. What is the advantage of using brachytherapy for treating prostate cancer? A. It delivers radiation from the outside. B. It can treat larger tumors more effectively. C. It targets the tumor with minimal damage to surrounding tissue. D. It requires no anesthesia. Answer. C. It targets the tumor with minimal damage to surrounding tissue. Rationale. Brachytherapy, C, allows for precise radiation delivery, minimizing damage to healthy tissue surrounding the prostate. 147. What is the typical treatment duration for high-dose rate, HDR, brachytherapy? A. A few minutes to an hour per session. B. Several days of continuous radiation. C. Several weeks of daily treatments. D. A few days of intense radiation followed by weeks of rest. Answer. A. A few minutes to an hour per session. Rationale. HDR brachytherapy, A, typically involves delivering high doses of radiation over a short period, often lasting a few minutes to an hour per session. 148. Which of the following is a possible side effect of brachytherapy for prostate cancer? A. Severe weight loss. B. Urinary symptoms such as frequency and urgency. C. Loss of taste and smell. D. Hair loss. Answer. B. Urinary symptoms such as frequency and urgency. Rationale. Urinary symptoms, B, such as increased frequency and urgency, are common side effects after prostate brachytherapy. Weight loss, A, loss of taste, C, and hair loss, D, are not typical. 149. In which of the following scenarios would external beam radiation therapy, EBRT, be preferred over brachytherapy? A. For superficial tumors that are easy to access. B. For tumors in locations that are difficult to reach with brachytherapy. C. For tumors that require highly targeted radiation. D. For cancers with high risk of recurrence. Answer. B. For tumors in locations that are difficult to reach with brachytherapy. Rationale. EBRT, B, is preferred for tumors located in areas that are difficult to reach with brachytherapy. Brachytherapy excels in localized tumors, but may not be suitable for deep or inaccessible tumors. 150. What is the potential long-term effect of permanent brachytherapy seed implantation in prostate cancer patients? A. Chronic pain in the prostate. B. Sexual dysfunction and urinary problems. C. Increased risk of lung cancer. D. Brain function impairment. Answer. B. Sexual dysfunction and urinary problems. Rationale: permanent brachytherapy for prostate cancer, B, can lead to long-term side effects like sexual dysfunction and urinary problems due to radiation exposure to the surrounding tissues. 151. What is the most common complication of brachytherapy for gynecological cancers? A. Bone marrow suppression. B. Vaginal stenosis and fibrosis. C. Severe nausea and vomiting. D. Brain swelling. Answer: B. Vaginal stenosis and fibrosis. Rationale: vaginal stenosis and fibrosis, B, are common complications after brachytherapy for gynecological cancers due to radiation effects on the vaginal tissues. 152. What is the main purpose of radiation shielding during brachytherapy? A. To protect the tumor from radiation. B. To prevent radiation from affecting the surrounding healthy tissue. C. To increase the dose of radiation to the tumor. D. To reduce the patient's pain during treatment. Answer: B. To prevent radiation from affecting the surrounding healthy tissue. Rationale: radiation shielding, B, is used to protect surrounding healthy tissues from unnecessary radiation exposure during brachytherapy. 153. In prostate cancer brachytherapy, what is used to guide the insertion of radioactive seeds into the prostate? A. An ultrasound or CT scan. B. A surgical procedure. C. A radiation dose meter. D. An MRI scan. Answer: A. An ultrasound or CT scan. Rationale: ultrasound or CT scan, A, is commonly used to guide the insertion of radioactive seeds in prostate brachytherapy to ensure proper placement. 154. How long does it typically take to complete a course of temporary brachytherapy treatment for prostate cancer? A. 1 to 2 days. B. 1 to 2 weeks. C. 4 to 6 weeks. D. 6 to 8 months. Answer: A. 1 to 2 days. Rationale: temporary brachytherapy for prostate cancer typically takes only 1 to 2 days, A, as the radioactive sources are inserted for a short period and then removed. 155. Which type of brachytherapy is used for treating superficial tumors? A. Intracavitary brachytherapy. B. Superficial brachytherapy. C. Interstitial brachytherapy. D. Intraoperative brachytherapy. Answer: B. Superficial brachytherapy. Rationale: superficial brachytherapy, B, is specifically designed for treating shallow, superficial tumors by delivering radiation directly to the surface of the skin or very close to it. 156. What is a common side effect of brachytherapy used to treat breast cancer? A. Severe hair loss. B. Skin changes, such as redness or irritation. C. Lung damage. D. Severe gastrointestinal distress. Answer: B. Skin changes, such as redness or irritation. Rationale: skin irritation or redness, B, is a common side effect in breast cancer brachytherapy, as the radiation can affect the skin near the treatment area. 157. What is a key benefit of using brachytherapy for head and neck cancers? A. It allows for the treatment of tumors in difficult-to-reach areas. B. It provides a quick recovery time. C. It does not require radiation shielding. D. It can treat metastases effectively. Answer: A. It allows for the treatment of tumors in difficult-to-reach areas. Rationale: brachytherapy, A, is particularly useful for head and neck cancers because it can precisely target tumors in hard-to-reach areas, minimizing damage to surrounding tissues. 158. What is the most common treatment for prostate cancer using brachytherapy? A. Low-dose rate permanent seed implantation. B. High-dose rate temporary seed implantation. C. External beam radiation therapy. D. Chemotherapy. Answer: A. Low-dose rate permanent seed implantation. Rationale: low-dose rate permanent seed implantation, A, is the most common brachytherapy technique used to treat prostate cancer, where radioactive seeds are permanently placed in the prostate. 159. What is one of the main reasons brachytherapy is preferred over external beam radiation in some cases? A. It is more effective for treating deep tumors. B. It requires fewer treatment sessions. C. It is less expensive. D. It does not require any form of anesthesia. Answer: B. It requires fewer treatment sessions. Rationale: brachytherapy, B, often requires fewer treatment sessions compared to external beam radiation, as the radiation is delivered directly to the tumor in a more concentrated manner. 160. Which imaging technique is commonly used during brachytherapy to guide placement of radiation sources? A. MRI. B. Ultrasound. C. X-ray.
D. CT scan.
Answer: B. Ultrasound. Rationale: ultrasound B is frequently used in brachytherapy, particularly for prostate cancer, to guide the accurate placement of radiation sources in the tumor.